All right, ladies and gentlemen, thank you very much. This is the Federal Affairs Advocacy Task Force for the County of Santa Clara. The hour of 2 o'clock having arrived, we will begin with a call to order and ask the clerk to please establish the presence of a quorum.
Vice Chairperson Lee
Good afternoon, present.
and Chairperson Simidian.
Present. Thank you very much. And that takes us to public comment. Public comment is that portion of our agenda set aside for comment by members of the public on non-agendized items that are properly within the jurisdiction of this committee. Do we have any speakers under public comment?
We do not have any requests to speak.
All right, no requests today. Thank you. That takes us to item number 3, which is to approve consent calendar and changes to the task force agenda. And Supervisor Lee, before I ask if you have a motion to offer, I will report that unfortunately, Mr. Bert Margolin is out ill today.
Oh, no.
And we wish him well and a speedy recovery from whatever troubles him, but that means he will not be available for the discussion today, particularly around dense breast tissue and the state of things at the federal level. So without objection, I'll simply ask that we hear that at our next HHC meeting, since that is a place where you and I both serve.
Sure.
And of course, the topic would be entirely relevant there. All
Great.
right. With that understanding, motion to approve the consent calendar and changes to the task force
so
agenda?
moved.
All right, motion by Lee, second by Simidian. Any commenters on the consent calendar?
There are no requests to speak.
Let's call the roll.
Okay. Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye.
Thank you. That passes.
Thank you. That takes us to verbal reports, if any, from the chair and the vice chair. I have none today. Supervisor Lee?
None as well, thank you.
All right. Then that takes us to item number 5, and we'll get a report from the Office of the County Council. And Mr. Press, no pressure, but in Mr. Margolin's absence, you're kind of center stage. So what would you like to tell us about the items that are agendized?
Sure. Just wanted to focus on 2 items today. First, a very brief update on the mifepristone case that went, so far, it went all the way to the U.S. Supreme Court. And then second, I want to talk about some proposed rules for the mental health parity law at the federal level. And that latter portion is, I have to get a little bit into technical details, so that's probably going to take a little bit of time. So I'll start with the short item first. So that's the update on the what's called Alliance for Hippocratic Medicine versus FDA. As you may recall from our June meeting, this was about some ongoing litigation brought against the FDA over their approval in the year 2000 over one of the 2 drugs used for medication abortions called mifepristone. After a frankly very surprising ruling from a Texas district court that found that the FDA's approval year 2000 approval of mifepristone should be essentially nullified amongst a number of other FDA regulatory actions. That was then appealed to the Fifth Circuit Court of Appeals. You may recall this board authorized the county counsel's office to co-author and submit an amicus brief, which we did. The Fifth District Court of Appeals in New Orleans gave partial relief in that it allowed the original approval of mifepristone from the year 2000 to continue to proceed, but it actually affirmed many of the other dispensing relaxation requirements, if you will, that the FDA had subsequently enacted. That then went all the way to the U.S. Supreme Court. And at that point, again, with briefing from the county by way of amicus briefing, with many others, the Supreme Court then granted a stay and halted all of the effect of the district court order. And that stay remains in effect until the Supreme Court finally rules on this whole matter, as they say, on the merits. So what's happened in the interim is that on August 16th, the Fifth Circuit released its opinion based upon further argument where it more or less mirrored its earlier ruling, again finding that the original approval by the FDA in the year 2000 of mifepristone would still be permitted. In other words, mifepristone is still legal and permissible to prescribe and dispense, but Fifth Circuit again affirmed the lower court's halting of all the other dispensing relaxation efforts, dispensing by mail, not requiring by physician. The good news is that Fifth Circuit decision has no practical effect at this moment because the U.S. Supreme Court's stay is still in effect nationwide. So it seems highly likely that the federal government will petition for certiorari of that latest Fifth Circuit opinion, and we will also, at the board's direction, likely submit another amicus brief.
Timing on the determination on the merits?
Well, let's see. If the petition for cert goes in relatively soon in the next few months, it seems likely that it could be briefed and maybe argued this coming Supreme Court term. So we could get a decision from the Supreme Court if that were to occur by June of next year. And then depending on what they say, they could either send it back down for further proceedings or they could make a dispositive ruling that would more or less decide the case.
Supervisor Lee, questions on this before we go to the next matter from our council?
No, I think it seems to me the only takeaway I have is right now everything is status quo
That is
until the
yep.
Supreme Court takes over.
That is the message.
That's all I'm
Status
getting
quo.
out of this.
Yep.
Okay, that's all I need. Thank
Great.
you.
Got it. Mr. Press?
All right, so the second matter pertains to proposed rules to the, and I'm going to get a little technical here and there, but I also want to kind of pull out the focus and talk about what's actually going on here. These are proposed rules to implement the Mental Health Parity and Addiction Equity Act of 2008. And I'll emphasize 2008 because that's relevant to the story today. So it's short acronym, the MHPAEA. That's quite a mouthful, so I'll just be saying Mental Health Parity Act today.
Would you give us the acronym one more time, though, just so I can make sure my notes are right?
MHPAEA,
MHPAEA.
Mental Health Parity and Addiction Equity Act of 2008. Believe it or not, it has even a longer name, but I won't
Okay.
get into it.
I'm sorry to interrupt.
No problem. So the three different federal departments working together, the Department of the Treasury, the Department of Labor, and the Department of Health and Human Services, all that have different regulatory jurisdiction and interest. Altogether, the three of those departments issued new proposed rules to implement the Mental Health Parity Act not too long ago on August 3rd, 2023. Public comments are due 60 days later, which is October 2nd, and the County Council's office is, as you might imagine, looking at to what degree and on what issues we may want to submit public comment. And also, just as a timing matter, if these proposed rules were to go in effect as written and as currently envisioned by those three federal departments, they're aiming for a January 1st, 2025 effective date. Although they are offering that as well, that effective date, that can also be the subject of public comment in terms of whether it should be sooner, whether it should be later. As you can imagine, there will be opinions on both sides of that.
Mr. Press, excuse the interruption. If this sounds repetitive, it's because it is. I want to ask you to go back over the same ground again. So what happened in 2008?
And it's just, as I said, this is why it's part of the story. In 2008, Congress passed the Mental Health Parity and Addiction Equity Act, which, believe it or not, was an update from a 1996 law. And then since 2008, the federal government, through its various administrative agencies, has proposed and promulgated various sets of implementing regulations, right? To fill out all the detail about how do we get there? How do we get to parity?
And forgive the back and forth, but I gather that in a very tactful way, you're trying to underscore the fact that it has taken 15 years to get us to the point where we have proposed but not yet adopted regulations?
This would be, if I'm not mistaken, either the third or fourth set of implementing regulations.
What happened to the first two or three?
Well, as the preamble, the very lengthy, and here's the entirety of it. Here, the very lengthy, several hundred-page preamble documents how these earlier efforts were not effective. And in fact, notes, as this committee has noted several times, and the Health and Hospital Committee has noted several times, as far as mental health parity. And when we talk about parity, just to bring everyone into the conversation, we're talking about there's what we call medical surgical benefits, the traditional sort of objects of healthcare insurance, and then we're talking about, in addition, mental health and substance use disorder benefits. The parity between those two is what we're talking about when we talk about mental health parity. And what these federal departments are finding consistently is, notwithstanding the enactment of the law 15 years ago, notwithstanding 2 or 3 sets of implementing regulations, we are still not at parity. And so this is yet another effort to try to zero in on how to get there. And I'll just sort of jump to some of the detail.
Please.
What's really interesting is this is sort of like you keep, the federal departments are trying to make a better and better mousetrap with each iteration. And what I find in this particular version is that the focus is on outcomes. So before I get into the detail, let me just sort of focus on what's really happening here. So there's numerical parity. For example, the law and some of the earlier versions of the regs focused on numerical or quantitative parity. For example, similar dollar limits for both medical and mental health benefits, things of that sort, that appear to offer parity. But again, in practice or in operation, it wasn't actually producing parity. So consider this farming analogy, if you will indulge me. We can have 10 seeds of corn for medical benefits, 10 seeds of corn for mental health benefits. Plant them both. Now that sounds fair, right? 10 and 10, that's parity. But for the medical benefits seeds, they get more water, they get better light, they get fertilizer. And what happens? They produce a lot more corn than the 10 other seeds. So that is the approach of this version of proposed regulations, is it's outcome oriented. So what they're saying is it doesn't matter if it appears in writing that your plan, your evidence of coverage, i.e. the plan documents, it doesn't matter if the plan appears to offer parity of medical and mental health benefits. We want to see in operation, are they producing parity in outcome? So I think it's a little clever, but as I said, they're trying to create a better mousetrap here. So the focus, there's a few other things going on in these very lengthy proposed rules, but the primary focus, and again, this is where it gets a little technical, is on what's called NQTLs, or non-quantitative treatment limitations, right? This is, we're getting down in the weeds here. So that's the first, is to focus on these non-quantitative treatment limitations, or NQTLs, both how they are written and how they act in operation, i.e. looking at outcomes. So that's the first part of it. The second part of it is to then require health plans to document and demonstrate both the inputs and outputs. How are these NQTLs designed, and how have they worked in operation? Because one of the one of the impetuses for this particular version of implementing regulation is when these departments looked at how other types of NQTLs were being documented a few years back. They did an audit of all these different reports produced by all these plans. Not a single one was sufficient. What else has happened in the interim? And again, this is something not unknown to this committee. In the interim, we know, and the departments have so found, that the mental health care crisis has increased. The need is greater. It's increased even more so because of the pandemic. The opioid crisis and other substance abuse crisis has increased and gotten more severe in the interim. And in particular, the impact on children and adolescents has become more severe in the interim. And so, again, these federal departments said it's time to focus not just on what appears to be parity, but what actually is happening, and why is what is written as parity, why is that not operationalizing as parity? So again, that's why they're getting down into the nitty-gritty on non-quantitative treatment limitations. So what types of things qualify as non-quantitative treatment limitations, or NQTLs? One of them would be different ways of producing different networks of providers. So for example, you can have a provider network for medical providers where, even though it might be difficult to get a provider off that provider list with thousands of providers, it is ever much more so difficult to actually find a provider on the mental health network. The preamble actually talks about that as a phantom network, where literally no one is available. Or what is available maybe is of only certain provider types, or maybe the quality isn't there. And so what happens if you can't actually acquire or get a provider for mental health services off of those phantom networks? Two things. Either you're going to go without, which according to the preamble, quite a few people did go without mental health care services that they were otherwise lawfully covered and entitled to, or they went out of network and paid out of pocket themselves, which typically these are much more expensive, obviously, than if they were in network. So that's one thing. Another factor that relates to differing provider networks between healthcare, medical care, and mental health care is different credentialing standards. So again, if these non-quantitative treatment limitations manifest as a different style of credentialing, making different requirements, more stringent requirements for mental health care professionals, that is going to impact the network, and in turn the network adequacy, i.e. the availability of providers to take someone in need. So that's one example. Another is differences in reimbursement. This can take, again, a variety of forms, and it has to do, it's very complicated, but it has to do with how are rates constructed for different types of providers? Because as you can imagine, there's not a one-to-one correspondence of medical provider and mental health professional. They have different degrees, different backgrounds, different standards for when they can see patients on their own. But what the departments, the federal departments looking at this found is that there are differing reimbursement structures. Not that those couldn't be justified, but now what these federal departments are asking the plans to do is say, explain this to us. And when it results in differing uses of these different types of professionals, explain to us how you think that is still fair. Another example is differing what we call prior authorization or utilization management techniques. Now, this whole issue of prior authorization utilization management it's really what managed care is all about, right? You can't just, in most managed care plans at least, you can't just pick a specialist whenever you want to. It has to be approved. Or if you go to the emergency room, it typically has to also be approved, although sometimes after the fact. But there's different types of controls in place to make sure that a member, a plan subscriber, a patient, is using their benefits correctly. But what the federal departments found is that there are different types of utilization management systems in place for medical versus mental health benefits that materially affect how many visits will a person be authorized for, or what sort of review has to take place. For medical benefits, what they found oftentimes is that the authorization is automatic. Whereas for mental health benefits, there's much more of a process. Certain types of providers have to get involved, oversee, review earlier authorizations. All of these things that slow down the process and make it much more difficult for people to access the benefits that, again, as written, appear to be available and appear to be in parity with medical. So that's, again, where these federal departments are going, is they want an outcome-oriented approach. And what they're saying quite explicitly multiple times in these proposed rules is that different outcomes are presumed to reflect the fact that a plan is using or applying an NQTL in a manner that violates the federal law. So you start with that presumption. Now, again, many types of presumptions can be rebutted if you have the right data, but as I mentioned earlier, the last time the departments got those reports from the various plans and audited them, they found that not a single report was sufficient in explaining why there was these disparities in outcome. So it imposes much more stringent documentation and demonstration requirements on all plans. So that's going to be something that, and I guess this sort of goes to the effective date, while the law is the same law, in other words, the Mental Health Parity Law of 2008, obviously it's been in effect for 15 years, these new regulatory specifications will require plans to frankly, hire some folks with the expertise and put a lot more effort into the documentation if they want to try to overcome these presumptions of lack of parity. Let's see, what else can I say about this? Remedies, as much as I could tell from at least the preamble to these proposed regs, the remedies take essentially three forms. One is that if the federal departments to whom these plans are going to be obligated to report find that they were unable to document and demonstrate why there was a lack of parity between certain benefits, mental health and medical, then they will be prohibited from applying those NQTLs. So in other words, if there's a prior authorization requirement or a difference in reimbursement, those will be prohibited under the federal law. Secondly, it'll be reported to the state regulatory agency, which in California most likely will be the Department of Managed Healthcare and the Department of Healthcare Services, depending if it involves government.
With what consequences following or flowing from the referral to the states?
Well, I can only speak for California. I'm not familiar with the different types of health plan regulatory agencies in other states, but I do know that for the Department of Managed Healthcare, they have a very robust toolkit of things that they can do to address a non-compliant with the law health plan, from corrective action plans, fines, even pulling the license for the managed healthcare plan. There's all sorts of different remedies that can follow. And the third, which is I find very interesting, the plans will be required to notify members individually, literally along the lines of, "Dear member, we write to inform you that we have not been complying with the mental health parity law in the following respects." So it will put individuals on notice who presumably then can avail themselves of either grievance procedures in the plan, grievance procedures with a state regulatory agency, and/or presumably alert advocates and advocacy groups about some of these practices as well.
Thank you. Supervisor Lee? This is, I think, very important stuff, but as you say, we are really deep in the weeds at this point. Let me check with the clerk, see if we have any commenters. I don't believe we do, but
Yeah, we currently do not have requests to
all right.
speak.
Then, Mr. Press, could I ask you to go back to the current state of affairs and the timeline from this point forward? So we have a third or fourth set of regulations that have been proposed by various federal departments and agencies. Are they in the comment period now? Did I understand that?
Yes, comments are accepted until October 2nd, and you can go to the Federal Register website, which is one word, federalregister.gov, and then just type in mental health parity, and this will come up. I can find the exact number if you want it.
That's all right. And the comment period ends when?
October 2nd of this year.
Ends October 2nd, okay.
Yes.
And did I hear you earlier that the hope and expectation then is that by January 1 of 2025, these might be effective?
That is the proposed effective date.
And then presumably somebody would be monitoring over time to see how that worked out for us.
Well, the federal departments will have to make a decision. Again, there will undoubtedly be comments on both sides to both advance and delay that date.
Okay, then. Well, our only agendized item today is to receive the report. Supervisor Lee, any other comments or questions, or would you like to simply move that we receive
Yes,
the
so
report?
moved.
Motion by Lee, I will second.
Okay.
Mr. Press, anything else before we call for the roll and say thank you for the report?
No, thank you.
All right. That's quite a timeline. Call the roll.
All right. Vice Chairperson Lee?
Aye.
And Chairperson Simitian?
Aye.
Thank you. Motion passes.
Thank you. Motion passes unanimously. That takes us to item 6. But let me just check, is Josh Tosney here?
Yes, can you hear me?
Yes.
Thank
they
you.
are on the Zoom.
And please help me with the proper accent on the right syllable in your last name.
You said it perfectly, Mr. Chair.
Thanks, Mr. Tosney. Let me just ask, I know you're standing in, there you are on my screen. Thank you so much. I know you're standing in for others who are out today. Thank you for that. We know that Mr. Margolin is out sick. Is there another component to item number 6, or is that it?
That's it.
All right, well, that's it means in this case, just for the record, as we indicated earlier under item number 3, we will continue that item and anticipate hearing it at the Health and Hospital Committee. And for those who are wondering how that works, as it happens, coincidentally, Supervisor Lee and I are serving on both those, both that committee and this task force. So thank you, Mr. Tosney. And then let me say, I think that takes us to item number 7, which was a general update on what's going on in the federal health world. But again, Mr. Tosney, Mr. Margolin is out sick. Does that mean we will just continue that as well to the Health and Hospital Committee?
Mr. Chair, if it's your preference, Prime Policy Group, which will be making the report on item number 8, is ready to stand in to give an update on this item number 7. So
Thank you.
if that's your preference, they can do that.
All right. Then let's get the benefit of whatever Prime feels they can and would like to offer today. So we are, for the clerk's purposes, on item number 7. And I'm turning now to the folks at our advocates, Prime Policy, and we'll ask them to introduce themselves. Who's there from Prime to give us a bit of an update on what's happening in the federal health world specifically?
Thank you, Mr. Chairman. This is Rich Mead with Prime Policy Group, and I'm going to give a report on the appropriations and the authorizations pending before the Congress. And as part of that, I'm going to touch upon the relevant health updates that Mr. Margolin was going to report on, but I will cover as part of my report. If you'd prefer, I can lead with those, or I can get to them when it comes up during my prepared report.
Mr. Mead, thank you. I think what I'd like to do is ask you to lead with those just because we have an agendized item number 7, which is specific to health. And I want to make sure that we accommodate public comment, which the clerk is handing me a note saying we do in fact have public comment on this particular item. So let's talk health, federal health world first as item number 7, and then I'll ask you to pause so that I can take public comment and or questions and comments from the committee members, Supervisor Lee and myself. Thank you. Go to it.
Great, thank you. Well, there are quite a few expiring health programs before the Congress. Starting with, there's a program that allows for the federal government to outreach to low-income individuals to make sure they are signed up for the proper health insurance program. There's a state option for Medicaid coverage of substance abuse disorders. The community health centers need to be reauthorized. The National Health Service Corps needs to be reauthorized. There is an expiration of the disproportionate share hospitals program, and also the graduate medical education. So those are the expiring provisions, and we anticipate and expect Congress will extend all of those programs at least for the duration of the continuing resolution to keep the government funding and open. In addition to those programs, there are 2 big issues that are before Congress right now, and the committees are actively engaged in both the House and Senate. The first is there's an interest in Congress to moving to what they call a site-neutral payment system for Medicare, meaning they want to even out, because under current Medicare law, hospitals get reimbursed different amounts based upon where the care is given, whether it's in the emergency room or not, or other sort of portions of the hospital, they can get different payments, and they want to go to make that an equal payment regardless of the care setting. And if they do that, it's going to save the federal government a very significant amount of money, and frankly could be detrimental to a large number of hospitals. There's just a briefing today held on Capitol Hill where advocates for hospitals rolled out some data showing what specific effect this payment policy would have on hospitals, and we will seek to find if we can get the information about the hospital in the county and share that with you as a follow-up to this report. The other big issue is Congress is looking to reform what we call PBMs, the pharmacy benefit managers. Those are the companies, and it's a remarkable thing in that 80% of this market is concentrated in 3 companies. So it's not a very competitive market, but these are the companies that provide your pharmaceutical benefits. And in doing so, they have a lot of authority in terms of which medicines they allow to be covered and which ones they exclude from coverage under your insurance plan, your pharmacy insurance plan. Congress is very interested in adding more transparency to these PBMs, and they're also interested in taking away their authorities in terms of coverage and in terms of reimbursement levels. So it's a very complicated matter, but it's one that there's actually a lot of bipartisan interest and support in seeing that through. And so we are expecting that at some point before the end of the calendar year, Congress is likely to act on that PBM reform. They may couple it with the site neutral payment reform too, and they may also include longer term reauthorizations for the programs I just walked through. So that's kind of the big focus in the healthcare world in Congress right now. And I'll pause there for any questions or discussion on those issues.
Supervisor Lee, and then I'll have a question or two myself. Thank you.
Thank you, Mr. Mead. You were talking about the, I guess, HR 4822, that's the Price Transparency Act, right? And also the 3284 regarding the site-neutral payment policies. So both of those passed the committee with pretty super majority, 25 to 16, one's 23-17. Does it look pretty much like this is something that should pass the House, given these numbers? And second is, so what, you passed the House, right? Do you think the Senate would take on it as well, from what you could read?
Great questions. Those bills were reported out of the Energy and Commerce Committee on strong bipartisan votes. Similar but different versions of those bills were reported out of the Ways and Means Committee on a partisan vote. We're expecting as soon as possibly today to see a compromised version that merges the two committees' versions of these bills. Regardless, we anticipate, however they adjust these bills to reflect input from both committees, however they do it, that should pass the House. That should pass the House for sure. In the Senate is very interested in the PBM reform, and they've got their own versions of that. They are less interested in the site neutral payment reform policy. However, in talking to the Senate Finance Committee, which has jurisdiction over this, I think they're of the mindset that, if this is done as part of an end of year package and they're going to do what we call sort of horse trading. So, maybe the Senate gets more of their PBM reform, their version of PBM reform, in exchange for taking on a version of site neutral payment. They're willing to do that. So there's a decent chance that both the PBM reform and the site neutral payment policies in some version can get through both the House and Senate before the end of the year.
Thank you. Mr. Mead, let me ask you to help me at least connect some of the dots here on PBMs, and then I'll go to site neutral payments. How does this affect, if it does, why is it important, if it is, to the county as a governmental entity and to our constituents as just 2 million folks who are presumably going to be affected in some way by the outcome of this legislative debate? So let's start with PBMs. I don't mean to be flip, but I guess my threshold question is, so what? So if they do this, how is the world a better or worse place?
So to the extent the county has exposure, it's over the health coverage you provide to your employees. And so the PBM, the companies that are the PBMs, they are making the argument that if you do these reforms, it's going to make insurance of the drug coverage more expensive for employers to provide. I'm not sure if I agree with them, but that's the argument they're putting forward. So there's potential exposure for the county directly. For your constituents, I believe that it will help. I personally believe, and again, I am not a fan of these PBMs, so for full disclosure, I personally believe that if they do these reforms, I think it will help lower the drug costs for individuals with their insurance.
Got it. So the argument against is that it has the potential, these reforms have the potential, argue some, to push up the cost of the insurance if the insurers are obliged to loosen up on the formulas, yes?
Yes.
The consumer upside, or in the case of the county employees' upside, potentially, is that it would make a greater number of drugs available through the insurance product at a presumably lesser cost out of pocket during the course of a year to the employee or the consumer. Do I have it straight so far?
That's my interpretation,
Okay.
and you got it correct.
No, thank you. I'm always looking for that connecting of the dots, as I call it. And then how about site neutral? What are the impacts on the county, if any, and the impacts on the general public consuming these services?
So this will, if they move to a site neutral payment, it will affect hospitals in different ways. And so for as I understand the issue, some hospitals will be a much greater reduction in Medicare reimbursement than for others. I don't know specifically about the Santa Clara County Hospital, how they would fare on this. Like I said, there's a report that it was released on Capitol Hill today, and we are trying to get our hands on that so we can look that up to see what this independent analysis says the impact will be for your hospital.
Thank you, Mr. Mead. I'm going to ask Mr. Tosny, because he drew the short straw and is carrying the burden today. Could you please make sure, and I'll press Mr. Press into service as well. Gentlemen, could you both make sure that this question gets agendized with and through my office for the Health and Hospital Committee, and that we specifically look at the impact on our county and our county residents? I think that's the next logical set of questions to be asked and answered. All right. Mr. Mead, anything else on the healthcare front? I think we do have at least one person who'd like to speak on this item.
The only other item that's in the what I would call the healthcare space is one of the pending. It's a health issue, yes, but it's sort of lumped in with another issue, and that is the farm bill is about to expire on September 30th. And as part of the farm bill authorizes and funds the nutritional assistance program. And there are many people who believe the nutrition is healthcare. And so people need good nutrition in order to stay healthy. And so the SNAP program that's part of the farm bill, that's the former program known as food stamps. That is part of the reauthorization process for the farm bill. And I'll just add some color on that, in that there are some Republicans, particularly in the House, that want to break off the SNAP reauthorization from the Farm Bill reauthorization. Historically, the two have traveled together on a bipartisan basis, the farm programs and the nutrition programs, but there are some voices in the House that want to break the two apart. The good news is the chairman of the House Agriculture Committee does not want to do that. He wants to write the farm bill in a bipartisan way and authorize the nutrition programs along with the farm production programs as well. So I think from the county's perspective, that's a good news, because I think you want to preserve that linkage between the nutrition programs and the farm programs.
Got it. Thank you. Let me turn to the clerk now and see if we have speakers either in the chambers or online. I don't think we have anyone in the chambers.
None in chambers, but we do have one virtually.
Let's go right ahead and hear from that speaker for up to 2 minutes.
All right. Our next speaker is Blair Beekman. You will have 2 minutes to speak. We are unmuting you. The timer will begin when you begin speaking.
Hi, Blair Beekman here. I'll try to make my comments short today. Thank you very much for the description about farm bill issues and how this item has come up many times before, actually, in its connections, the farm bill and its connections with food stamp issues and the SNAP program and such. It's traditional to work on these things together. Boy, I don't want to hurt tradition, but this does come up continuously year after year often. So good luck on how to work on it and work through it again. And people getting food and nutrition is a good consideration of health and how to consider health things. So good luck on those efforts. I just wanted to quickly offer in all this work on this item that you talked about and people paying their bills and going to their health service providers to eventually pay their bills. A reminder that I really hope that Santa Clara County can learn to take a more proactive position on the future of biometric camera technology that will be placed often in healthcare facilities and bus transit services and such. To take a proactive position is important. To be open and clear about what we're doing with our tech future is important. I'd hate to think that Santa Clara County, in its good beginnings, is going to dodge this subject in the future. Good luck in being open with it. Thank you.
Thank you very much. Let me just confirm that that was our only speaker on this item.
Yes, that concludes our speakers.
Then I will turn to Supervisor Lee, ask for a motion to receive the report.
So moved.
Second by Simidian, call the roll.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye.
Thank you. Motion passes.
Thank you. Carries unanimously. That takes us to item number 8, which is the broader prime policy report on the federal legislative, regulatory, and administrative climate. Who would like to lead from prime? Mr. Mead, do we go back to you or one of your colleagues?
Yes, please. I will start, and then I'm going to turn to my partner, Ms. Dorton, for an update on specifically the community project funding requests the county has made through the appropriations process and are included in the House reported appropriations bill. So she'll give a more detailed report on what's of benefit to the county that's pending before Congress.
Go right ahead.
And thank you. And here's the status of the appropriations process. The Senate Appropriations Committee has reported all 12 of their appropriations bills on very strong bipartisan votes. And they're reporting their bills adhering to spending limits put forward by the Fiscal Responsibility Act, the legislation that raised our national debt limit. The House has passed 10 of its 12 bills out of committee and 1 has passed House floor, but the House bills are generally more partisan with many Republicans in the House viewing the spending level set in the Fiscal Responsibility Act as a ceiling rather than a floor. So they don't want to start their appropriations bills at those levels, or they're starting them in many instances below those levels. They're also doing a little bit of a, I guess I'll call it a trick, in that they are on some of their priorities, they're funding at closer levels to what was in the Fiscal Responsibility Act, and then presumably taking the savings out of future bills that contain programs that they're less favorable about. So, for example, under their current plan, their veterans bill funds the veterans programs robustly, but by doing so, they're going to have to take a lot of money out of the social welfare programs in the labor HHS bill. So it's not really a sustainable path for getting bills through both the House and Senate and signed by the president, but nevertheless, the House is on a more partisan path in the process. There are only 11 days where both the House and Senate are in session together in September. And so they'll need to use those precious few days to work out a continuing resolution, or CR, to keep the government open beyond the end of the fiscal year on September 30th. There is speculation that the Senate is going to pass an appropriations bill, possibly this week, that will include the military construction and the agricultural full appropriations bills, a CR for the rest of the appropriations bills, and a supplemental funding bill that includes funding for relief from Hurricane Hillary that hit California, and for Hurricane Idalia that's hit Florida and Georgia, and some other funding for some other natural disasters that have happened in our country, as well as providing some additional military and humanitarian assistance to Ukraine. And as part of that supplemental bill, there is some additional money to beef up some funding for enforcement of crossings at our southern border. And it's not yet clear what could pass in the House of Representatives. It's possible that a bill like that could pass on a bipartisan basis. We are hearing that there are a number of Democrats who are offering to help Speaker McCarthy pass a bipartisan bill such as that. However, the problem that Speaker McCarthy has is that there are too many members of his conference who are pushing for unrealistic funding levels way below what the Senate will pass. And there are too many Republicans who not only do not fear a government shutdown, but actually are pushing to have a government shutdown. And there are also some Republicans pushing for some unrealistic policy riders to be included on the bill, including policies that are not acceptable to the Senate around our southern border. So the history in the Congress is that when members of Congress push for unrealistic policies on the CR, they generally don't achieve them. And they're also they're ones to blame for the shutdown and face the negative political consequences of shutting down the government. So I would say, just to sum up my outlook for a government shutdown, I would say that the chances of a government shutdown are not zero, but they're also not 100%. I would, say it's probably a 50-50 proposition that we get to a government shutdown. It's not quite clear what the path will be to keep things open, but they're working on it. And as I mentioned in agenda number 7 about the expiring health provisions, there's also a number of other programs, significant programs that are expiring on September 30th, including the income support program for needy families, the temporary assistance for needy families, or TANF program, the child care funding that was provided in the CARES Act, the National Flood Insurance Program, just to name a few. So again, I expect that whatever CR comes over from the Senate to the House will extend the authorizations for those federal programs as well. Now, it's possible that the committees in Congress could work out maybe 1 or 2 of these reauthorizations outside of the CR, but I don't think that's very likely. I think in all likelihood, they're probably going to carry those forward for at least the duration of the continuing resolution. I already gave the update on the Farm Bill as part of agenda number 7. So let me now turn to my partner, Ms. Jordan, for her update on the community projects that are in the appropriations bills.
Thank you very much. Ms. Jordan, welcome.
Great, thank you. Good afternoon. So even though we've heard there's a lot of uncertainty around the appropriations process, we do have good news to report to the county on their community project funding requests, at least at this stage, that were submitted, those that were submitted to the House delegation. It's important to note that as the negotiations continue overall with respect to appropriations, eventually, as we know, the final House bill and the final Senate bill will have to be, reconciled. So everything is on the table until the final bill passes. However, we've identified the following for the county that were included in the Transportation and Housing Urban Development Appropriations Bill that was reported out of the House Appropriations Committee in July. So specifically under the HUD, Housing and Urban Development, under the account, which is the Economic Development Initiatives account, the county would receive $3.5 million for the Silicon Valley African American Cultural Center. The requesting member there was Representative Khanna. The county would receive $2 million for emergency shelter and transitional housing for homeless veterans. Both Representatives Khanna and Lofgren each submitted the requests, and both requests appear to have been included. So as it reads now, they will each be responsible for having gotten $1 million. So the county would get $2 million. As I said, though, this potentially could get negotiated out in negotiations with the Senate, but for the moment, that's the way it's reading. Next, the county would receive a little over $1 million for farm worker housing rehabilitation, for the farm worker housing rehabilitation and electrification pilot program. Representative Lofgren was the requesting member there. And then I wanted to note two other items that overall that you all would be interested in knowing. The Santa Clara County Housing Authority would receive $850,000 for revitalization of the Buena Vista mobile home park community. And that requesting member was Representative Eshu. And secondly, the Santa Clara County Office of Education would receive $500,000 for affordable educator housing in Santa Clara. And that requesting member was Representative Kama. So those are just those are the ones we thought the task force would want to hear about today. And then we'll definitely keep you posted as negotiations continue. And that's all I have on those for today.
Thank you, Ms. Dorton. Before we let you go, sort of a broader overarching question. You and I have worked together along with your colleagues now for some years. Is there an evolving sense of the Congress as to how members view these community projects, which were once called earmarks and, as you will recall, of course, at one point much maligned? They seem to have fallen back into the category of routine with some new guidelines around them. That's my take as someone who's not obviously nearly as close to it all as you are. Your take on, I'm just trying to think out loud a little and ask, in the interest of the county for the years to come, what do we think the future of community projects, formerly earmarks, might look like?
Well, my view is that they're very, they have to follow much, I think, much more stricter, I don't know if that's the right grammar, more strict guidelines than they used to. And it's a very narrow window with which they have to, that they can request something. And additionally, they can each only request a few things. I wish I had the list in front of me right now. I don't. I don't think I've shared it with with the task force, but I know we've talked about it on other calls before with the staff. But I know that there's only a certain number. They don't get that many bites at the apple, if you will. And so I think it's a very manageable way to bring things back to their districts, for lack of a better way to say it. I don't know if my colleagues have anything further to say on that, but I think because it has very specific guidelines, it's feels to me much less complicated.
Let me ask you the question in a slightly less formal way. If you had $5 in the office pool, would they continue to have community projects / earmarks next year, the year after, and the year after that? So the next 3 years?
I like to say yes, but I'll let Mr. Mead, I think I just heard my colleague say something. So I would like to say yes, but I like them. So I don't know whether he does it.
Mr. Mead, others?
I'll just add that these projects, they remain very popular. And we're seeing a lot of members of the House who are successfully achieving these projects. So they remain very, very popular. So I think their popularity, they will continue on. Now, as Ms. Dorton referenced, in the House, they've put further restrictions on which programs and what kinds of projects can be funded. For example, they put in place a provision from the program at HUD upon which you're drawing some of your projects. They put a prohibition on those for funding any entertainment venues, for example. So they're putting more restrictions on, but they still remain popular, and I still think they'll remain in effect for. I think we're in that business for a while, is my estimation.
All right, thank you. Just I think helpful to know as we think about when, where, and how we reach out to our federal representatives for help with particular projects. Anything else in the way of a report on item number 8 from the folks at Prime?
Mr. Chair, I would like to recognize that Tom Pike from the Office of the Representative is raising their hand online.
Please do.
Hi, Thanks for raising this. I just wanted to add a couple of points. And again, I'm Congressman Khanna's district director, Tom Pike. We do get 15 requests each year at this point. I think the challenge that we're being faced this year, as described, is the change in leadership in the House, which will obviously be there next year as well. I would agree that it's a very popular program, but it's been very challenging to try to get by the strict guidelines that have been presented with Republican leadership. And a good example of that is the African American Cultural Center. The county really stepped up to be the recipient of the funds on that will, in addition to the money that has come from the county, they've been a great partner on that project, but we had to essentially describe a multi-purpose project as a housing project for more infrastructure rather than healthcare, education, cultural, and so on. And that's given the strict guidelines. So bottom line is, I really hope that this goes forward for years to come, but I think that if the House leadership changes, that there will be more options for the types of programs that will be funded.
Got it. Thank you, Mr. Pike. And as always, thank you for participating in these meetings. You and Congressman Khanna's office have been very much engaged in these conversations over the last number of years. So thank you again for that.
Absolutely. Thank you all.
Let me turn to our clerk and see if we have folks either online or present in the chambers who would like to offer comment.
So we do not have anyone from the chambers, but we do have one virtually.
Let's take that virtual speaker for up to 2 minutes.
Okay.
The speaker's not virtual, the means are virtual. Thank you.
Indeed. The next speaker is Blair Beekman. You will have 2 minutes to speak, and the timer will begin when you begin speaking.
Hi, Blair Beekman. Thank you for that interesting clarification. For this item, I think it was mentioned, there was some, I didn't quite fully understand, but a correlation between the war that's going on in Ukraine right now and the border issues at the border. And that was a bit odd to me. I'll have to review that. But I wanted to speak actually on this subject today in the first place, and that nicely connects to that September of this fall, of this time, was really, it's a kind of a checkpoint and border mark time that we were supposed to have an understanding about the current effort of war in Ukraine. And this could have been a time to start to really begin a peace negotiation process that we are going through at this time. And I just wanted to note that here at this time that we're going through it. We're going to a new level of warfare, basically. And you notice the concepts of warfare are rising. They're talking about nuclear-tipped bullets and missiles the U.S. wants to now give to Ukraine. The threat of nuclear war is always there, and the threat of a NATO invasion is larger than it used to be. So I just think we're headed really in a bad direction, and I ask again that to stop and to ask for peace. There's ways to negotiate peace, and the more that we practice these concepts of war, it ends up affecting our decision making here at home, and that hurts the most because we're building something pretty awesome at home right now, I think, and we need to be allowed that space. And I want to work so much at these things at the local level that's why I'm asking that we stop war at the international level. Thank you.
And that concludes our speakers.
Thank you, Madam Clerk. Supervisor Lee, unless you have additional comments or questions, then I will ask for a motion to receive the report, which is the called for action under item number 8.
So moved.
Motion by Lee, second by Simidian. Call the roll.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye.
Thank you. That passes.
Passes unanimously. Thank you very much. And Madam Clerk, I believe that is the last item on our agenda today. And for that reason, understanding that we have continued the items that Mr. Margolin was scheduled to deliver to our Health and Hospital Committee. Without objection, hearing none, we are adjourned. Thank you all very much.